to Vold. I completed my practicum this spring at Kansas City Hospital. I was able to explore a subject way out of my comfort zone, but I had a group of phenomenal mentors and was able to connect many aspects of my time in the MBA program during my practicum experience. I think the history that surrounds North Kansas City is indicative of the bond it has with its community. To share its humble beginnings, North Kansas City started their journey when the community decided it needed a hospital on this side of the river. They came together and had a 2-day charity event to fund the building, and in 1958, an 80-bed facility was born. North Kansas City has undergone many changes in the last 60 years and now stands as a 451-bed campus ready to serve its community as an independently owned, not-for-profit hospital. With a not-for-profit designation, they must complete a community needs assessment every 3 years. I was able to connect with the Senior Director of Community Health and Wellness and got to see their vision come to life. It was pretty inspiring to see all they've accomplished and what they plan to accomplish in the future. Their services range from cancer treatment and management to mental health and many community outreach programs and preventative medicine services. North Kansas City also holds an array of accreditations and certifications, but to only touch on a few, they are currently CAP certified in the laboratory, accredited through the Joint Commission, and their nursing department has been granted a MAUNT designation. My practicum project. It was very unique, but also very challenging for me, and also very timely with the way that technology is going, but I got to be out of my comfort zone of my normal day in and day out in the laboratory. I had many mentors along the way, reaching from the informatics department to the associate counsel and compliance team and the health information management department. North Kansas City isn't the first hospital and nor will it be the last to want to bring innovation into its doors to improve patient care. Artificial intelligence is a new hot topic in healthcare. And as I learned, there are many ethical debates on how it can be used, if it can be used, and if it can, how safe it is. It can be deployed in many settings like clinical support systems, most commonly being assistive documentation during patient appointments, generative and non-generative AI platforms like ChatGPT, and the list goes on. The deployment of these systems is highly complex and takes a well-diversified team to cover all angles of what it means to bring AI into patient care settings, but also for its organizational use. This was the first part of my project that by far was the most challenging, as I had to put myself in the shoes of people that would be involved in this process and take it from their perspective. Without proper governance for these systems, there is chance for large patient and organizational impact that could be irreversible. So this governance team and the governance model has to be well vetted and fairly robust. I wanted to briefly discuss what goes on into developing an AI governance program, and this is just a condensed version. The first is policy development. Governance structure may be varied based on the type of AI wanting to be deployed in an organization. Legal compliance evaluates the initial risks and how to mitigate them, as well as any legal applicability for patient and organizational data. The financial impact goes beyond the monetary value of what the AI system costs the organization to implement, as it also encompasses the time needed to vet every aspect of the model. The evaluation of bias is extremely important, and in short, a badly trained system will produce poor and inaccurate results. Clinician adoption is another challenging aspect, as it can involve a pilot program to see if the system truly performs as expected and creates the impact it was meant to. Finally, this process needs to be under continuous review, both for the governance structure as it is applied to other AI models, but also the AI model currently being deployed. I want to take this a step further, even though I couldn't do this during my time at North Kansas City as a part of my project, but I also believe it will be a while before this happens. I'm a microbiologist and I work in the lab, and after being in an organization that is continuing and considering the use of AI in the future, I started going down the rabbit hole a little bit. But I would like to see these systems, after the passage of an AI governance model and the completion of a vetting program, impact the laboratory. I think there is much room for improvement, particularly in how we combat new challenges in delivering faster patient care and optimizing current processes that I also think could be more accurate with the use of AI. Since I was in a hospital setting, I had the privilege of seeing most of my MHA course tools come to life. I did extensive research and had to learn how to consolidate many resources of data into an executive summary that would present through an explanation of AI governance, what it entailed, and how we need to proceed in the future with deploying these systems. To say my brain was completely hurting during this process is an understatement. I went through many meetings and levels of leadership in the organization to do this, and it was intimidating at first working with executive leadership, knowing that this could potentially be something that is actually used in the future. I learned a few lessons at North Kansas City, ones that I think are invaluable for any new professional in their field, regardless of their leadership role. Knowing how to navigate the C-suite. This was a challenge. And there's a level of expectation when you're in the executive office, one that I had to learn in my various meetings. Within these meetings also came opinions and critique. And in the professional world, you cannot take these critiques personally and must be able to use them to challenge your current viewpoint and improve from them. I had to work with many different people in departments, gaining an appreciation for what expertise they can bring to the table, and it was another eye-opening experience. I learned many new things from putting myself in other departmental shoes and gained an appreciation for the perspective they provided me with during this process. Effective communication is vital everywhere, but when a project requires multi-departmental involvement, touching base with your team is key to keeping the project on schedule. This way segues into my next point: the ability to complete projects on time. When working with different departments, having an understanding that the one project is not the only thing people are working on and that time is very valuable is a valuable skill to take on in any leadership position. To conclude, I wanted to brag a little bit about North Kansas City Hospital. I would recommend any student or professional looking to work in an organization that fosters a compassionate organizational culture to go to North Kansas City. Though my time there was short, I can speak highly of my mentors and the day-to-day interactions I had with the staff. I gained some lifelong connections professionally and am very thankful for the opportunity to have gone with my practicum project. Thank you very much.